Namaste. Hello, everyone. I'm Dr. Renee Mehrra, and today I'm joined by a very esteemed panel from India who are going to tell us all about the initiatives taken by the Ministry of AYUSH in Government of India in healthcare management, especially in COVID-19 management. We'll be also talking to them about AYUSH's collaborative efforts in the World Health Organization, as well as evidence-based scientific studies and clinical trials that are underway in Ayurveda that creates a new and robust conversation on the role of traditional medicine in public health and disease management. So thank you all for joining us today. Let me introduce my panel, Dr. Rajesh Kotecha. He's the Secretary of the Ministry of AYUSH in Government of India since 2017. He's an Ayurvedic physician and has a doctorate in Ayurveda. He's authored 2 books, Beginner's Guide to Ayurveda and Concept of Atattva Bhinivesha, which is all about mental illnesses and psychiatric disorders. Dr. Kotecha is the former Vice Chancellor of Gujarat Ayurveda University. He has received many coveted awards, including the Padma Shri in 2015, the Global Ayurveda Physician Award, and the Ayurveda Ratna Award in 2008. Thank you so much, Dr. Kotecha, for joining us today.
Namaste.
Namaste. Dr. Bhushan Patwardhan is a national research professor designated by the Ministry of AYUSH in the Government of India. He's one of the top cited biomedical scientists in India. He is the former Vice Chairman, University Grants Commission, Chairman of the Indian Council of Social Research. He's a member of several academic research and policy committees, such as Lancet Citizen Commission, National Board of Examination, World Health Organization, and NCIM Health Research Institute in Australia. Professor Bhushan Patwardhan is the Fellow, National Academy of Sciences and National Academy of Medical Sciences in India. He's the founder, editor-in-chief of the Journal of Ayurveda and Integrative Medicine, published by Elsevier. He's the recipient of several awards, holds 8 Indian and 2 US patents, and has 175 plus scientific publications and 10,000 plus citations. That is an astonishing achievement. Thank you so much, Dr. Patwardhan, for joining us today. Thank you.
Thank you. Thank you.
Next, we have Professor Dr. Tanuja Nesari. She's the director of the All India Institute of Ayurveda in Delhi. She has a PhD in Ayurvedic pharmacology. She's the chair for Health Sector Sub-Skill Council for AYUSH under the Ministry of AYUSH. She has worked as the CEO for the National Medicinal Plant Board, Ministry of AYUSH. Currently, she's a member of the General Assembly of ICCR, which is the Indian Council of Cultural Relations. She's a member of the Board of Governors of Central Council of Indian Medicine. She serves on various academic boards of many universities. She's on the Advisory Council of AAP USA, that's the American Association of Ayurvedic Professionals in the United States. She has 74 papers and over 90 review articles in index journals. And she's also the executive editor of review of many index journals and has authored and edited 15 books in English and in regional languages. Last but not the least, we have Dr. Geetha Krishnan right here. He is Dr. Geetha Krishnan Gopal Krishna Pillai, that's his full name, works with the World Health Organization at Geneva, and as a technical officer at the Traditional Complementary and Integrative Medicine Unit, Dr. Geetha supports the objectives of WHO to integrate traditional medicine into the national health systems of its member states. He leads the development of the M-Yoga mobile app for the World Health Organization. Dr. Geetha has an MD in Ayurveda and extensive clinical and research experience in integrative medicine. He's a key member of AYUSH-based COVID-19 response task force of the Government of India and is an organizer of several clinical trials on COVID-19 internationally as well as within India. Dr. Geetha has been engaged in traditional medicine and health-related policy and advocacy in several countries. Thank you all for joining me from India. And This is going to be a great discussion as to what we are doing with the health challenges. And I'm going to first address my first question to Dr. Rajesh Kotecha. Dr. Kotecha, we know that the pandemic has upended lives. It has created so much of distress emotionally, psychologically, economically. And it's also created a paradigm shift in healthcare, both in the public as well as in policymakers. Tell us the role of AYUSH in the last 1 year, how it has addressed critical health challenges brought on by the pandemic in India.
Thank you for inviting me, Renee, and for this, very prestigious forum and for this discussion as a panelist. Ministry of AYUSH, Government of India has contributed significantly in the mitigation and management of COVID-19 across the country. In this regard, Ministry of AYUSH has taken several steps as suggested. For example, in the beginning of the crisis in the month of end March 2020, we have issued an advisory for self-care, home care for the prophylaxis or for immunity promotion. And all those advices were based on, at that time, the experiential evidences and empirical evidences and suggested by eminent physicians. Later on, we also have validated those suggestions, and we found that all of them have significant contribution as an immunomodulator or as a, if somebody is suffering with the lung issues or some respiratory symptoms, it is they are very good. So this is one thing that we did. We also have issued the guidelines for the physicians of AYUSH, like Ayurveda, Siddha, Unani, homeopathy. We also were able to offer the health system, our infrastructure. We have huge infrastructure across the country, like some more than 50,000 beds and 750 plus colleges having at least 100 beds. So in addition to these 50,000 beds, so it's huge. So we were able to offer them to use as COVID care center and COVID facility. We also we trained more than 33,000 AYUSH master trainers, and subsequently they have trained AYUSH professionals, physicians and paramedics. So across the country, more than 100,000 AYUSH professionals were used during COVID crisis, during first wave and during second wave also. Professor Patwardhan is here, Dr. Geetha Krishnan is here. Professor Patwardhan, under his chairmanship, we have constituted an interdisciplinary task force. And this task force have actually helped us immensely. Professor Tanuja Nesari and Geetha Krishnan were also the member of this task force. And it was an interdisciplinary task force. So having members from across the different disciplines like ICMR, Indian Council of Medical Research, or the Department of Biotechnology, and different eminent institutions, AIIMS Delhi, and AYUSH professionals, AYUSH research councils. And they have actually helped us immensely to visualize and design different clinical trials, different research, different prophylactic and observational studies, preclinical studies, etc. And we were guided by them. One last thing I want to mention is about AYUSH Sanjeevani mobile app based study. So we have launched a mobile app known as AYUSH Sanjeevani, and we were able to collect more than 1.35 crore, it's like 13.5 million data sets from across the country, which is more than 1.2% of the population of India. And from these data sets, we found that 85% of Indian population, they have used AYUSH measures for prevention of COVID-19. And out of this, 89.98% respondents agreed to have benefited from these interventions. So that is huge, and it is now published also. Government of India also has released National Clinical Management Protocol based on Ayurveda and Yoga for management of COVID-19. And also post-COVID-19 care protocol also has integrated AYUSH suggestions. So those are broadly the contribution of Ministry of AYUSH.
So you've given us a good snapshot of what AYUSH is doing. AYUSH has recommended many studies at this time to determine the impact that you talked about, the efficacy of COVID-19 interventions. I wanted to ask you, Dr. Kotecha, are these studies statistically powered? Are they well designed? Are they robust? And secondly, from the preliminary outcomes, can we determine the effective prophylaxis against COVID-19?
Yes, actually, First of all of these studies, as I mentioned, is powered by statistical designs and batteries, and protocols were actually thoroughly reviewed. When all of these were monitored by Professor Patwardhan as a chairman of this task force, and with the help of all the experts, it was thoroughly reviewed. I want to mention that these studies in number more than 126 at the 151 locations across the country, very huge. But all of them were not only clinical studies; they are all combination, multi-center trials, randomized controlled trials, observation studies, single-arm studies, preclinical studies, blocking studies, or large-scale prophylaxis studies. So it's combination of prophylaxis studies, combination of treatment studies, and looking at the antiviral properties, anti-inflammatory properties, etc. So there are a lot of mechanistic studies. So I want to also mention happily that out of these studies, 90 studies are already completed. Remaining studies are either completed or in the last phase of completion, and data evaluation is going on. Out of these studies, we have 19 studies already published into reputed journals. 25 is available in public domain through preprint servers. So it's huge. And there are 48 more publications, manuscripts are under review process. So all of them were very robust. And as an outcome, we were able to translate two candidates, like one is AYUSH 64 and another is Kabasura Kudinir, is a Siddha medicine. And we were able to recommend this for the treatment of asymptomatic, mild and moderate COVID-19 patients. And it has actually helped a lot, particularly during the second wave, because these medicines were recommended just in the middle of the second wave. And we were able to help home isolation patients tremendously. So I want to just cite an example that we were able to follow 90,000 patients who were in home isolation have taken this intervention as an add-on to standard of care. And in our preliminary analysis, we found that none of them did require hospitalization. None of them died. They all recovered. So this is huge, and we are in the process of data cleaning, etc. I also want to mention about the robustness of the studies. We have a DSMB third. We are looking after all these studies as a kind of third-party observers, so that we do not deviate into our goals. And also, ashwagandha as a prophylaxis is another achievement. Professor Patwardhan may want to talk more about that, because he was the leader or lead author into some of the publication of ashwagandha. So we are now in a position to recommend. Very soon we will be able to formally recommend ashwagandha as a prophylaxis for COVID-19, because we found that ashwagandha is equally or even more effective than HCQ. So we found it through multi-center trials and some robust studies. So these are the outcomes of all these studies. Thank you.
That's good. And you talked about ashwagandha as well. And I think many other Ayurvedic herbs, such as ashwagandha, gudichi, yes, and rasainas like Chyawanprash, Kushmanda, the sales went up in the pandemic time. Yes. Would you attribute this to the AYUSH's health, the education, the concerted efforts in outreach, the scientific-based evidence that is coming out? Because it went almost 400%, the growth of these sales went almost 400%. So would you say it's all about getting into the area of public health and health education, health management in India?
Yes, actually, the best example is that even our Honorable Prime Minister, has, in several occasions, he has mentioned about AYUSH intervention. He has advised the people to use AYUSH intervention. So at this level, as highest level, it was recommended. So people have taken it, very religiously, and they got benefited also. I want to cite this example of one of our study, which Professor Tanuja Nesari, her institute did with Delhi Police. And with 80,000 Delhi Police, we did this study as a prophylaxis of Chyawanprash and Untitled and AYUSH Kwath, etc. And we found that we were able to reduce the mortality by 1/4 as compared to the Delhi population. And they were all frontline warriors. and the incidence rate also went significantly down. So this is one of the example. And also, actually, you are right that other candidates like Guduchi, Yashtimadu, Kalmeg, Vasa, there are so many candidates, and tremendous work has happened into all those candidates, and it has contributed significantly into the commerce because those were scientifically validated, backed with evidences, and people took it very religiously. It is into the culture of the country. People, they have accepted it very well, and we had also experience of global commerce. So there is not only commerce have multifold increase in India, but there were 3 to 4 times growth of commerce, export of certain candidates like ashwagandha, for example. Ashwagandha is one of the 3 most popular supplements in US. So
that's right.
Those kind of things has happened. And recently we had one of the agency did a study for us about the size of our sector, and we found that it grew almost 3 times into last 5 years, and now our size of the manufacturing sector is $17.5 billion, which is 100,000 crore, and it is going rapidly year-on-year basis at the rate of 20+%. So in another 4 years, 5 years, it will be double. So that kind of commerce is also happened after this COVID crisis. Yes.
I'm going to talk about the treatment interventions, Dr. Nassari, later on. But Dr. Patwardhan, we do know, as Dr. Kotecha said, that these studies are robust and they are replicable and they're authentic and they are statistically powered. And you're one of the mentors, also with Dr. Geetha, that actually helps in publication and brings more also capacity building. So how has your mentorship and your Dr. Geetha Krishnan's mentorship helped in the research area?
Yeah, research, as Dr. Rajesh Kotecha has mentioned, this task force has done work by taking people from different disciplines together. And Renee, let me tell you, COVID has brought modern medicine and traditional medicine on the same level playing field, because COVID is as new to allopathy as new it is to AYUSH or Ayurveda, So nobody can have a monopoly. So monopoly of any system is not good, because in every system there are some positive and some limitations. So we should take best advantage of whatever is available, and that opportunity COVID has provided us, and therefore the amount of people they have openly used AYUSH interventions, what Dr. Kotecha said, more than 80% of Indian population has used one way or other some kind of a traditional medicine. So this mindset change is very, very important. People's way to look at Ayurveda or yoga has completely changed during the COVID times, and they have realized the benefits of it. And one of the trials which we have conducted, head-on comparison of hydroxychloroquine with ashwagandha, randomized controlled clinical trial. The preliminary results of this trial have been just published last week in one of the Elsevier journals, and where we have shown that ashwagandha has certainly benefits over hydroxychloroquine, and it is significantly better as far as the adverse reactions are concerned, which are very, very less in case of ashwagandha. So when we have safer and effective prophylactic agent like ashwagandha, we need not go in tested or tested to be ineffective drugs like hydroxychloroquine. And this is just a beginning. And to do that, we have collaborated with top institutions in India. Council for Scientific and Industrial Research, CSIR, is the largest network of scientific institutions in India. And AYUSH Ministry and CSIR collaborated together to come out with robust clinical trials of statistically powered studies, in which we have done this prophylaxis study with ashwagandha and add-on study with standard of care, adding Guduchi, Yashtimadu, and Pipli. These are the combinations which we have used, AYUSH 64, And these study results are just coming out, but AYUSH 64 studies already have been published, and we have shown that AYUSH 64 significantly has reduced hospital stay. Now, really remember, in this critical period, if we are able to reduce the hospital stay even by 1 or 2 days, it's a big achievement. Yes. And AYUSH 64 has done it without causing any harm to people. So this is something which has come out very, very prominently during COVID period, and the kind of scientific rigor that we are keeping, we are ensuring, and their mentorship comes in, because while Ayurvedic Vaidya are very good in clinic, they are excellent clinicians, they are very knowledgeable, but at the same time, modern methodology they may lack, they may not have been get exposed to that extent, So our responsibility is to undertake that research. We cannot keep on asking Ayurveda Vaidya questions, what research you are doing. As basic scientists or as clinicians, it is our responsibility to do that research and not just to criticize them. So precisely we did this. So we created a group, hand-holded each other, and this is the result of collaborative activity, bringing different disciplines, keeping our egos aside and putting people's interest up front.
That's true. And Dr. Nassari, that comes back to you, because as a segue to what Dr. Kotecha and Dr. Patwardhan have talked about, All India Institute of Ayurveda last year started this holistic Ayurveda treatment to patients that had mild to moderate symptoms of COVID-19, using the traditional medicine interventions along with advanced technology. And what has been the success rate? Because you use those interventions, and Dr. Kotecha talked about the scientific evidence and the prophylaxis effect against COVID-19. So what was determined from those interventions?
Yeah, thank you, Dr. Renee. And I feel honored to be the part of this highly accomplished panel with the Secretary AYUSH, with the Kotecha ji, Bhushan Patwardhan ji, Geetha Krishnan ji. So it gives me really a pleasure to say that the success rate at COVID Health Center, where the tagline is a care with compassion, that was the differently holistic and integrated approach. With the holistic treatment, standard treatment protocol, the success rate, we can say the percentage is 99.99%. And we say this with the evidence and with the confidence that we had the holistic Ayurveda intervention, then the diet, medication, the prayer, recreation, counseling, and everything was supported with the modern biomedical tools of investigations, which are really internationally accepted and understood for the COVID being undertaken, like RT-PCR, HRCT, immune markers, IL-6, 7, and all inflammatory markers as well. And for each and every patient, we have pre and post all those markers, and it is supported. We say that it is integrative and holistic approach, because we have the co-location of modern conventional medical doctors and the team of Ayurveda holistic practitioners at each and every bed was supported with the oxygen therapy as well, if it is as and when required, and all the support of the pulmonologist and all. So what is the success rate? 99.99%. But precisely, we can say that the mean recovery time of the symptoms was reduced to 50%. On the third and the fourth day, the patient was symptomless. Fever had gone, and there was a restlessness had gone, dyspnea had gone, and the outcome within the 10th day, average 9 to 10 days, patient had been discharged with RT-PCR negative, from positive to negative. And what was the feedback of the patient? That I have become the negative from positive, but I am going to home with the positive. That means with the positive approach, because with the recreational and the human touch as a care and compassion, with compassion. The overall feedback was, it was home away from home. They had one healing touch, and it was a familiar atmosphere with all the team, which was posted there 24/7 for taking care, always available for them on a through conferencing and video conferencing system. And the major outcome was that the severity was also reduced, and none of the patient, only 1% of the patient had to refer to the further tertiary care hospital, but the severity was reduced, and post-COVID complications were also reduced. They were back on their job. So this is what is the success rate of the holistic Ayurveda approach with the integrated and supported with the conventional biomedical tools of investigation.
How many patients approximately were treated with these protocols?
Yeah, with the in-house, we have treated thousands. Like we have COVID testing center, vaccination center, everything, helpline, outpatient many, but inpatient precisely 634. We have the precise data of indoor patient, in-house patient where we have treated. They stayed there for 10 days, that's there. And others, we had a flu OPD basis management, even with the AYUSH 64 and cabazitaxel. We have treated thousands of patients of mild to moderate on OPD basis, and where the data is meticulously maintained. And with the largest cohort study as a prophylaxis, as our secretary mentioned, with the Delhi police personnel, we had that is the success rate is, their mortality rate has been reduced down to 1.4 with the reduced incidence. In 80,000 patients, only 22% they had the mortality, and the incidence rate trend line was significantly low when there was a highest peak in Delhi also, but the trend line was coming down in Delhi police. That's the statistics, and the COVID dashboard tells us about that. And apart from that, in this COVID health center, we had also conducted more than 11 statistically powered clinical studies. So each and every patient has been meticulously followed, and that has generated to the success story, which we can say confidently and with the competence that there is a holistic strength in Ayurveda for the treatment of the COVID-19 as well. Thank you.
That's a great success story, Dr. Nassari. Dr. Krishna, coming back to you, some very exciting news. The World Health Organization's first global center is going to be established in India for traditional medicine. It's going to be opening up in India, hopefully this year, I guess. You will tell us more about that. So share the light on this new development and how it's going to really benefit everybody internationally as well, bringing traditional medicine right, to everybody.
Oh, thank you, Renee. And with the permission of the real steering group here, who are all assembled here, including Dr. Kotecha, Dr. Bhushan Patwardhan, and Dr. Tanuja Nesari, who are heading the Indian side of the task force in terms of the global center. I could tell you in broad sense what the global center envisages. The global center for traditional medicine is the materialization of a vision to make sure that traditional medicine is most appropriately utilized and given the right place in healthcare across the globe. And such a center which focuses on the strengths of traditional medicine and the weaknesses of the current system of health and the needs of the health in different communities are not available right now. And the whole purpose of the global center is to lay a foundation for becoming a pillar for developing such a robust a program which will help each and every member state according to their own resources, according to their own requirement, with evidence. So that's the most important part of the global center. This global center, or the global center for traditional medicine, will create evidence-based protocols, or rather, or formulate evidence-based policies which will allow the member states to decide, of WHO to decide what is to be undertaken using their traditional medicine resource, what is safe, what is effective, what can be utilized most economically, and what can be useful for their community. So this is the whole big picture of the global center. The real the objectives of the global center, where it is going to be happening, etc., is in fact outside my purview of discussion. But of course, probably Dr. Bhushan Patwardhan or Dr. Tanuja Nesari, who are members of the task force of the global center, might be able to throw more light into that.
But Dr. Kotecha, when do you think the center is going to be up and running?
As mentioned by Dr. Geetha Krishnan, we have a joint task force. From India side, we have Professor Patwardhan, Tanuja Nesari, and our Special Secretary, Sri Pathak, is participating. And from WHO side, there are a group of officers of WHO side. They are working together, and they are finalizing the details. So it is going on, and we are hoping that at least a coordination center for the main big WHO global center will be established within this year only, in the year 2021. Is a big task, because it is like it needs consultation from all across member states, and there are a lot of formalities. There is a agreement or MOU should be signed between the host country and it's known as HCA, host country agreement. We are in the process, and then we have committed, Government of India has committed full support and wholehearted support. So it is taking shape very fast. But I want to mention, when we talk about WHO, the WHO has also sponsored one of the study of, sponsoring is by South WHO CIRO, Southeast Asia Regional Office, and they have supported the study of impact of AYUSH intervention for the COVID mitigation in India. So they are independently doing it, and it is already studies going on. One more thing I want to mention is that with the help of WHO, we were able to have a joint study initiated in UK, LHSTM UK, and in India, with our Institute of Ayurveda is a partner institute, and LHSTM is a university, London School of Health and Hygiene. So we have started a study on ashwagandha as a prophylaxis in both the countries simultaneously, on big numbers, big size, like 1,200 volunteers. So it is also going on. There also WHO has helped us to coordinate with LHSTM.
Nice. Dr. Patwardhan, you are spearheading the Indian task force on the WHO venture. What can we expect from this collaboration? Dr. Geetha has already mentioned, bringing traditional medicine out, does it make it more accessible, affordable, equitable, inclusive? These are some of the things a lot of people in healthcare management would like to know. So share your thoughts on that.
Dr. Renee, this is work in progress. So at this stage, it is difficult to explain anything more on it. But one thing is sure, that the traditional medicine, the research in traditional medicine will be the most important agenda. Evidence-based practice is going to be another important agenda. And the center will really try to give traditional medicine its real due. Today, it is being ignored at large level in different parts of the world. And so whatever scientific research is necessary to bring it in the mainstream and really bringing various systems all over the world. There are so many traditional systems. So this is not, although it will be in India, it will look at the global traditional medicine in a way, and it will create some kind of a capacity building exercise also for traditional medicine researchers.
Dr. Krishnan, coming back to you, will this create a benchmark document which will help facilitate in the standardization of Ayurveda curriculum, accreditation, credentialing, so that it really it's streamlined? Do you think you would be able to, with WHO and AYUSH collaboration on this Global Center for Traditional Medicine, be able to create this important benchmark document?
In fact, it's a very important question. Even before the thought of Global Center for Traditional Medicine, the Government of India, Ministry of AYUSH has been in touch with WHO and has already initiated the development of a benchmark document or a technical document for the practice of Ayurveda as well as for the training of Ayurveda. So these are two very important documents that are going to come out from WHO simultaneously. It's parallel activity. It is not right now connected to Global Center for Traditional Medicine, but it is a parallel activity and it is already on the line. And in fact, if you a little bit of history, in 2010, WHO had come out with a benchmark document for training. And in 2017-18 onwards, we started working on a benchmark document for practice of Ayurveda. And in consideration of the tremendous growth during this period, between 2010 and 2020, the different experts we had consulted across the globe, more than 46 countries, they had been of the opinion that the training document has to be updated to the mark of the benchmark document, which is actually reflecting what is happening right now and what could be happening in the future in different member states. So this will be almost new documents which are coming out with the support of the Ministry of AYUSH. And as you rightly said, it's going to be really a determining factor and a supporting factor for many countries, especially like countries like US, where there are more than 5,000 or I think tens of thousands of Ayurvedic doctors, but there is no credentialing process, there is no accreditation process, which organizations have started. And I'm from working with the ministry together and discussing with the ministry and with the advice of the secretary, I'm sure that there is a lot of chance that a strategic and tactical support might become available for these organizations if they work together to create a accredited process within US. And I think I understand from the secretary here that from my discussions with him that if all the organizations are coming together, there could be a possibility that the ministry might be interested in supporting that activity also. So that's a very exciting time. I think in the next 5 years there could be a lot of change which could happen through these documents, as well as through the support and also the active organized work of the physicians in US. In US, Ayurveda might get credentialed and will get accepted.
Okay, so this is great news because it helps in the training of Ayurveda practitioners and in the clinical practice. So the benchmark document is something all of us are looking forward to. Dr. Kotecha, would you like to add on to this?
Actually, I want to add that also we are working with WHO for the inclusion of the Ayurveda, Unani and Siddha morbidity codes into ICD-11, Traditional Medicine Chapter. So this work is also going on. We also are working with them for the terminology of Ayurveda, Siddha, Unani. So a lot of things are happening with WHO. This is just an additional information in addition to what Dr. Geetha Krishnan said. And Ministry is committed that such kind of the innovative things is the need of the time, because there is huge demand, and we have to match this demand by innovative steps, which is scientifically relevant, scientifically evidence-based, and also which is like kind of acceptable to the entire sector, including the conventional medicine specialist also, based on all these evidences. So that is what we are creating, this ecosystem. And I'm very happy that things are going to very right direction.
That's great, because I know that AYUSH is one of the main aims of AYUSH is to promote, revive, and preserve the ancient healthcare systems, whether it's Ayurveda, Yoga, Unani, Siddha, homeopathy, naturopathy, and this gives an additional space to AYUSH with working with WHO with a benchmark document and having this Center for Traditional Medicine in India. Moving on to Dr. Tanuja Nassari, I know that Dr. Kotecha talked about it as well, the studies that are going on overseas as well. There are MOUs with many medical universities and hospitals around the world. So we're talking about the London School of Hygiene. Dr. Kotecha did talk about that. This is in UK. Then we have the European Academy of Ayurveda, Harvard Medical School, NYU in the United States, Sydney University in Australia, as well as with the governments of Austria, France, and Germany. Tell us, what can we expect from these MOUs, and what will be the areas that we jointly explored besides culture and context? Of course, that plays a very vital role, as well as research. What are the other areas that you'll be exploring with these countries?
Yeah, it's a very relevant question. Thank you, Renee, for this. And under the umbrella, with the support of Ministry of AYUSH, and under this Ministry of AYUSH, more than 20 MOUs have been already initiated, and out of which 9 countries basically we have the MOUs for the academic collaboration and conducting meaningful research, which can be translated into the mainstream practices. So basically, these are the academic and the research collaboration we have initiated. And through this, in this COVID pandemic, we have 9 research projects already in pipeline. And the one which already Secretary mentioned is with the London School of Hygiene, where Dr. Geetha Krishnan and with the WHOs, we have already signed the MOU. And it is at the stage of the approval of NHA, and it is in the post-COVID and the long COVID management with the ashwagandha. That's almost the September it will be initiated. So this is on the largest cohort study, and there are similar research studies for understanding the mechanistic study, molecular mechanism, omic study with the fees in Germany. Then we have the MOU with the some Guruchi-based combination in the treatment side of COVID-like symptoms and the post-COVID management with the Harvard Medical School, Spalding Rehab with Brazil, South Africa, and many other countries in the Germany. And with the Fritz Charles Foundation in UK, we have another studies we have initiated for establishing Center of Excellence in Dumfries House, and for the mental health and for in the public health. Those studies are also in the pipeline. And we have MOU with the Shimoga universities in the Japan also, and with the Western Sydney University in Australia. The one very important academic collaboration is for the writing the books also, and initiating various academic chair in these countries. So these are some of the studies on the COVID and the non-COVID also, which is a strength of Ayurveda. In the chronic diseases like musculoskeletal disorder, we have the public health and the community-based research studies already going on with the Spalding Rehab and the Harvard Medical School. And under the ministry has supported in us in the public health initiative within India, and with Spalding Rehab and with CSIR collaboration. This study is being undertaken, where the clinical aspects will be done in India and in Spalding Rehab, and the molecular mechanism will be studied by CSIR. So this is a retrospective and prospective, both these studies, and I think that has got the immense potential for the translation for the benefit of the humanity across the globe.
That's wonderful. And I believe there's also a partnership with the National Cancer Institute in the United States
Yes.
to address the effects of chemotherapy and radiation. What has been there in the collaborative efforts on this study and partnership?
Yeah, we actually, there's a very interesting project going on wherein it's a network of Indian institutes like ICER or NCCS, which are the top premium institutes from India, and NCI, National Cancer Institute of the NIH, as well as Memorial Sloan Kettering. So we are looking at therapeutic adjuvants. Now the adjuvant, ashwagandha as an adjuvant in COVID I talked about, but ashwagandha as an adjuvant can be used in several other conditions, and we are studying that, because inflammation, Dr. Renee, future is going to be managing inflammation and immunity. These are going to be the 2 key drivers, and Ayurveda has got strengths in both. And therefore, we are exploring various rasayana dravyas from Ayurveda, such as ashwagandha, which can be used to counter the chemotherapeutic side effects which people are facing. And so these studies are primarily preclinical studies, animal studies, wherein we are trying to look at various mechanisms and Very soon, I think the preliminary results will be out. But what we talk about is just a small fraction of the huge activities which are going on at the level of Ministry of AYUSH. The Central Council for Research in Ayurvedic Sciences, or CCRAS, they have undertaken several such studies in different parts of the world. So I think you'll have to do series of such interviews, to cover or to give better justice to this effort which is going on in India. But especially for the those who are in the US, normally may not know, and they may still think that Ayurveda is still in its primitive stages. That is a passe. Ayurveda and yoga, they have really started very, very aggressively going ahead with modern science and technology, and results of that, glimpses of that, we have started witnessing now.
Absolutely. And I think this is very important. And as you rightly said, there are many studies that are underway, whether it's musculoskeletal disorders, whether it's oral health, mother's health. There's a whole lot of studies that are going on, cohorts going on, nothing less than 10,000. So these are very exciting times, I think, for traditional medicine and taking it to the next level. Dr. Kotecha, there's also been a data generated through the AYUSH's Sanjeevani app on traditional medicine, which is being published in many scientific journals. Share the findings.
Actually, AYUSH Sanjeevani, I already mentioned that AYUSH Sanjeevani it is a mobile app created specially to have an impact assessment of AYUSH intervention in India for COVID mitigation. So we have initially used it for studying people's behavior for the prophylaxis, and we at that time during the September-October 2020. We have gathered these data sets of 1.35 crore or 13.5 million people, and we found that precisely 85.1% respondent have reported use of AYUSH measures for prophylaxis purpose. And out of that, 89.8% population people said that they have got benefited. But in addition to that, we have upgraded that application, and recently we have reused it for the study of AYUSH 64 and Kabasrakudin as a therapeutic intervention, as an add-on to the standard of care for home isolation patients of COVID-19. So we have repurposed it, and then we have created this module of weekly follow-up of 3 weeks, so 7 days, 14 days, and 21 days. And we were able to gather the data of 150,000 patients of COVID. Out of that, 90,000 have completed this full follow-up of 21 days. So that is huge, a huge cohort, and we are now working on it. I also, want to add this, that what Professor Patwardhan said, that there is a huge thing going on. So for the information to the people who is listening this talk, that AYUSH Ministry has also created a vertical, a portal on internet is known as AYUSH Research Portal, and one can type on Google AYUSH Research Portal. They can reach there. We have posted more than 30,000 publications of all AYUSH systems: Ayurveda, Yoga, Unani, Siddha, Homeopathy, Sovarikpa, and 30,000 plus publications. And it is all there available in searchable format. This is one thing. Another thing is that we need to talk less about other AYUSH systems. So I want to categorically mention that in addition to Ayurveda, a lot of other systems also have contributed a lot. Like, for example, in homeopathy, there is significant observation about the nosodes for COVID-19. This is one very good development that I want to cite. In yoga also, we did conduct more than 16 studies, and we found very good results. In AIIMS Delhi, we have a Center of Integrative Medicine Research, CIMR, supported by Ministry of AYUSH, and they are conducted, like you were mentioning, that there are a lot of areas of research like musculoskeletal, neurological, etc. So in more than 23 departments of AIIMS, different clinical departments, this center is studying on yoga intervention, and they found some very good outcome, like adjuvant to breast cancer, for example, or add-on of yoga in migraine. And although all of these studies are published, so there's a lot of things are going on other than Ayurveda also. That is what I wanted to mention.
Ministry of AYUSH has come out with very interesting another portal, which is called as clinical trial registry, clinical studies, the clinical case reports registry. So people from anywhere, and I'm sure Dr. Kotecha will talk about it, but anyone from the world who has done anything regarding COVID, they will be able to deposit their cases in this repository. So that repository itself will come in a future as a major practice-based evidence, because evidence is not only coming from science, it also is coming from practice, which today that documentation is missing. So this is one of the major steps that ministry has taken by creating this kind of a portal wherein Vaidyas or doctors or whoever is dealing with COVID-19 or any other disease subsequently can deposit their cases.
I see. And one can also subscribe to the AYUSH newsletter, which is it monthly newsletter, Dr. Kotecha?
Yes.
Yeah.
Yes.
So that
newsletter being published from Ministry of AYUSH and is available on our social media also.
Yes, yeah, that's right. Lastly, I mean, we could go on for a long time because this is such a enlightening discussion and you're sharing so much of your insights. But how do you envisage the future of traditional medicine as an integral part of health promotion and disease prevention, not just for infectious diseases, but for chronic illnesses as well? We're talking of holistic healthcare solutions. Telehealth is on the rise, as well as advanced technology alongside it. So what are your thoughts on this? And we'll not start with Dr. Kotecha first.
Actually, Dr. Renee, I can see the great future because now we are doing fusion of digital health and AYUSH intervention. So we are creating digital solutions for AYUSH interventions, which is the futuristic kind of step. And there is a coming up is an era of personalized medicine, where AYUSH interventions are being practiced since several thousand years. So we are doing some very interesting thing like Ayurgenomics at Institute of Genomics and Integrative Biology. And there are so many such things which is quite exciting. And I'm sure that future is of integrative medicine where the evidence-based intervention of traditional medicines, including all AYUSH and other traditional medicines, will be the properly integrated and will be the future of healthcare. Well, we talk about health more and disease management less. So people should stay healthy and they should not fall ill and require the support of the doctor. That is the dream, and that is achievable dream.
Dr. Patwardhan?
Thank you. Dr. Kotecha has summarized it very well.
Yes,
so the focus coming on health and not necessarily disease and cure. So that's how the personalized medicine and Ayurveda is actually a personalized medicine. And we are not only talking about drug development, Dr. Renee. We are doing a lot of research on basic concepts of Ayurveda also, such as concept of Prakriti.
Yes.
What is Agni? What are doshas? All these things are also going to give breakthrough research ideas which will progress modern science as well. So this kind of Ayurvedic biology, for instance, the research which is going on, so these are very exciting times. And I'm happy that even many modern progressive and forward-looking modern scientists are looking at Ayurveda with curiosity. This is a good change I'm seeing, and that's a bright future we are hoping. Thank you.
Dr. Nassari?
It is the tradition supported with technology, as what we are experiencing with our MOUs with IITs and the basic scientific laboratories. So tradition supported with technology will make Ayurveda and AYUSH system classical yet contemporary. So the tagline, the message we can say that the future of the medicine is in integration and future of the medicine is no medicine. As Ayurveda says that the Ayurveda is a science of healthy and happy life. So either it is a no medicine or it is integration. That's the future of Ayurveda.
Dr. Geetha, you'll be having hands full with the new center, global center.
In fact, really so. I think this is a very important perspective that you have put forward. Humans have, since about 100 or 150 years, progressed after creating a goal to achieve. And it is in health, it was during the Alma Ata Declaration when we said that by 2020, by the year 2000, everyone is going to be healthy. Then we, nearly around 2000, we decided that, no, we will be healthy by 2030. which is the Sustainable Development Goal. We are in 2021, and and looking at the way in which health systems are inadequate to manage even the current available communicable and non-communicable diseases put together, and anything new comes in, it creates havoc in the entire system. I think if the health systems are not going to utilize the huge human knowledge and resource which is available in the form of traditional medicine, be it Ayurveda, be it traditional Chinese medicine, be it Unani or homeopathy, we are not going to achieve 2030, SDG goals. And that will be at the cost of human lives, human health, and economic cost for countries. So it is better that nations and policymakers start looking at traditional medicine in the most appropriate manner, give it proper respect, use the resources in the best manner possible, and make sure that they are able to achieve their respective goals by 2030. Otherwise, I can tell you that in 2031, we will sit together and make a 2050, SDG goals, which will not be much different from the 2030 SDG goals. So it is essential. So there is no question of whether traditional medicine is useful. The question is, it is useful. The answer is it is useful. It is necessary. The question is whether we are going to use it or whether we are not going to use it. So those who use it will benefit. Those who don't use it will not benefit. I could tell you with one example, just to take, because I was with the help of the AYUSH Ministry, I was able to travel to Hyderabad during this past 3 weeks, and I went to two institutions in Hyderabad in modern medical hospitals who were managing COVID. And mucormycosis, the fungal infection was a major problem there. And mucormycosis was managed very well using Ayurvedic treatment in 2 hospitals in Hyderabad. And I saw the data of 119 patients. 119 patients who had been, identified with mucormycosis, with severe condition of mucormycosis, who have completely recovered with Ayurvedic treatment. So where do we stop the use of Ayurveda and traditional medicine? Is this to be decided by the modern medical community who doesn't understand Ayurveda? Or is it to be decided by the health community who requires Ayurveda and knows how to utilize Ayurveda? This is a question which is open for all of us. Thank you.
Thank you so much. I think the choice is ours. We take ownership of our health, and it's creating that paradigm shift that I talked about it earlier. And I think thanks to Sage Patanjali, Charak, and Sushruta for having that vision from those times to create these pathways to our health and to our longevity, to our wellness. And thanks to Ministry of AYUSH for reviving and promoting these ancient healthcare systems and strengthening them with evidence-based scientific studies and clinical trials. So this is a very exciting time. Thank you, Dr. Rajesh Kotecha, Dr. Bhushan Patwardhan, Dr. Tanuja Nesari, and Dr. Geetha Krishnan. Thank you all. And thank you so much for watching. I'm Dr. Renee Mehrra.
Thank you, Dr. Renee Mehrra. Thank you. It was nice.
Thank you. Thank you all.